I'm Becca. I'm 32 years old. I have been a registered nurse since 2018. I work at Singing River Gulfport in the endoscopy department, where I work in pre-op and mostly circulate in procedures. Since I was a young child, probably 8 or 9 years old, that's when I first started having severe symptoms and actually had my first upper scope. All I remember is taking Tums, antacids, avoiding certain foods, and that's kind of become my normal. My reflux had progressively gotten worse. I was on the maximum dose of protonics. Even going to a friend's house or even coming to work, I would have a little, I call my first aid kit, and it had Tums and protonics and all of the things you could think of, because that was my daily life, with having to constantly take medications and still having breakthrough symptoms. I just knew that that wasn't the quality of life that I wanted at 32 years old. The only treatment options that had ever been presented to me were PPIs, over-the-counter reflux medications. So it was just kind of piling on more and more medications.
And I had never heard of the TIF procedure until I started working here at the clinic with Dr. Juakiem.
Naturally, I was curious and I wanted to learn more about what exactly it was.
I'm Dr. Juakiem. I'm one of the advanced interventional gastroenterologists here on the coast. The TIF procedure stands for transoral incisional fundoplication. It is a procedure that's done endoscopically, minimally invasive. It creates something what we like to call an omega-shaped valve that minimizes any acid reflux from your stomach going to your esophagus.
Working hand in hand with Dr. Juakiem, when I learned this was an option, I knew that I had complete trust in him to move forward with this procedure. I had to have an upper endoscopy done with what they call a Bravo, which is a pH study. You're off of any kind of antacids, PPIs, for 10 days prior, and that was extremely difficult for me, being that I had taken it twice a day and then over-the-counter medications. And the purpose of that is to measure your pH, and that's one of the ways they identify that you're a candidate.
We saw her in the clinic. We did an upper endoscopy. We found that she actually has a large hiatal hernia, which predisposes her to the acid reflux disease.
And so I was informed that was through the roof, and so that I definitely was a candidate. He sat down and drew out a diagram and explained to me exactly what he would be doing, and also that there would be a general surgeon involved.
In a subset of patients who have a large hiatal hernia, usually 2 centimeters or greater, we have to use a multidisciplinary approach where we have to have a surgeon fix that hiatal hernia, thus bringing the anatomy back where it's supposed to be before we do the TIF procedure. She underwent the procedure successfully. She's always saying how it's a huge lifestyle change for her, that she's able to eat what she wants, whenever she wants. She doesn't have to avoid eating meals right before bedtime. She's able to drink the coffee in the morning. She's finally able to eat some spicy food.
I never thought that a life without reflux was possible for me. That's all I've known since I was a child. Oh gosh. I didn't realize how much I was suffering until after having this done. My quality of life has improved tremendously. Things as simple as being able to lay flat, not being worried about eating certain things hours before going to sleep. I have not had to take any medications for reflux. Again, I never knew that a life without acid reflux or constant heartburn and suffering from that was even a possibility.